Okay, the first question was reflect on the possible consequences of the charge nurses and civil actions and how could they have impacted the new nurse, the patients, family members. For the new nurse, I said this may impact the new nurse because she may not want to ask for help the next time she needs it, and it can be overwhelming being a new nurse, and she obviously wouldn't have asked for help if she didn't need it. And the charge nurse thinks that the new nurses aren't working hard because they're asking for help, which they should be because that's what the charge nurse is there for. She's a resource for them. It could impact the patient because if the nurse is asking for help and the charge nurse isn't willing to do it, then some patients may be neglected while the new nurse tries to care for other patients. And neglecting to help the nurse is also neglecting to help the patients, obviously. So this can cause a bunch of other problems. Like if the nurse gets caught up in one patient's room and something's happening in another patient's room, who knows how long that patient would be waiting to be helped, or the patient may try to get out of bed and this could cause them to fall if they're a fall risk. And that leads to a bunch of other problems. The family member, it could impact them because obviously in this video, the family member is standing there listening to this charge nurse talk about how the patient satisfaction rates are down. And if these rates are down and the family member who's listening to this charge nurse gossip on the phone, it isn't going to help with scores at all. And if this family member hears this, she may tell other family members or individuals in the community not to come to this hospital, and this can hurt the facility's reputation. The family member seeing the charge nurse tell the other nurse to give her a minute, since she just sat down, also shows that the patient needs are not as important as her gossiping about the other staff members. And then a time I personally experienced incivility was when a nurse was talking about something another nurse was doing. She was discussing how a nurse actually cussed in front of a patient, and instead of siding with her and gossiping with the nurse, I asked the nurse to pull the other nurse aside and discuss her actions. And I feel like this is the best way to go about the situation because it wasn't necessary to gossip about the nurses when they could have easily changed the behavior had they talked about it. Team steps to utilize in the future. In the future, I can use effective communication skills with other staff members, and using these skills will allow me to ensure that I am clearly and accurately talking to other individuals and staff. And I can use leadership skills to ensure that I'm dependable and a good resource for other individuals also. I can use situation monitoring to ensure that I'm assessing and understanding the situation so the team has a good outcome. Mutual support will also be beneficial to utilize in the future so I can help other individuals on my team and ensure that they know their responsibilities. And in the previous situation where I dealt with incivility, I think I used good communication, leadership skills, and situation monitoring when talking to the other nurse about what she should do about the other nurse cursing in front of a patient. I feel like I used mutual support when discussing what the nurse did because I assessed both sides of the situation and I supported the team members accordingly. So using the DESC script to deal with the incivility that I noticed in this video, at first I would ask to speak to the charge nurse privately. And I would say to her would be, you seem to be agitated with myself and the other new nurses lately, and I feel like you may be under a lot of stress with having to train all the new nurses while continuing to run unit as a charge nurse. And I do not want to agitate you by asking for help or asking questions. I just want to give my patients the best care possible. And I feel like I could benefit from your guidance and help during these times that are busy. And if you have any problems with myself or other nurses, can you come talk to us privately so other staff and patient family members are not hearing it? I want to succeed and make sure I'm a good new nurse, but I'm afraid if I'm not given the proper guidance to succeed, I may end up failing or harming a patient.